Hello, everyone. My name is Courtney, and I am a longtime therapist and clinical supervisor. This video is part of a trauma-sensitive series designed to make therapy feel safer, gentler, and more understandable, especially for families who are curious, nervous, or unsure about what therapy may look like for their child. With 25 years experience working with children and family, I know firsthand that starting therapy can bring up big feelings for both kids and grown-ups. Whether you're feeling hopeful, unsure, overwhelmed, or just curious, know you're not alone. In this video, we'll walk through what therapy is and isn't, how to prepare your child for their first session and what that first session will look like, what you can expect as a parent, and how therapy supports emotional growth, safety, and trust over time. Therapy isn't one size fits all, and that's a really good thing. Let's explore together how it can meet your child where they are and how you, as a parent, are an integral part of the journey. Children come to therapy for many reasons: big feelings, stress at school, family changes, grief, anxiety, anger, or simply needing a safe place to talk. Therapy is not a sign that there's something wrong with your child. It's a sign that they deserve support. Therapy is a resource, not a failure on your part as a parent or even a failure for your child. Kids thrive when the adults around them treat therapy as normal and supportive. Children take their cues from adults in their lives. Your tone, your facial expressions, and your language shape how they feel about therapy. So, what children need from you to help them thrive in therapy is calm reassurance. Children read adults like weather reports. When a caregiver's tone is steady and grounded, your child's body gets the message, I'm safe, nothing bad is happening. This lowers anxiety, reduces resistance, and helps therapy feel like a predictable part of life rather than a crisis response. It's also really important that we offer curiosity instead of pressure about therapy. Curiosity invites openness. Pressure triggers shutdown. Curiosity communicates you're in charge of your story. I'm here to understand you, not extract information. This preserves the child's sense of control, a core ingredient for therapeutic progress. As parents, you also want to give your child permission to go slowly in therapy. Many kids need time to warm up, test the therapist's safety, or simply just adjust to a new environment and a new person. When caregivers normalize slowness, the child doesn't feel like they're failing therapy. This reduces shame, increases trust, and prevents the child from rushing into topics before they feel ready to do so. It's also really important to validate their feelings. Validation helps kids feel seen rather than judged. When children feel understood, their emotional load lightens and they're more willing to explore hard things in therapy. Validation also teaches emotional literacy, which in itself is a therapeutic skill. Children also need predictability and routine, and this is well above and beyond just what is needed for therapy. This is what children thrive with. Kids regulate through rhythm. When therapy is consistent, same day, same tone, same expectations as much as possible, their nervous system can relax into the routine. Predictability reduces that buildup of anxiety and helps therapy become a part of the child's weekly structure rather than an unpredictable event. Besides talking about the do's of how to best support children through therapy, we also want to talk about what to avoid. It's important not to over-explain or give adult-level details about what therapy is and isn't. Too much information overwhelms children and can make therapy feel like a high-stakes medical procedure. Simple, concrete, age-appropriate explanations keep therapy approachable and non-threatening. And if this is something that you're struggling with as a parent, there are other videos within this series that talk to children about starting therapy at different age ranges. Telling children what they should talk about in therapy is also really frowned upon. This shifts therapy from their space to your agenda. Kids may feel pressured, ashamed, or worried about disappointing you. It also interferes with the therapist's ability to build that authentic rapport and follow the child's natural pace. Another thing to avoid is using therapy as a threat or trying to coerce your child into therapy. Threat-based languages such as "we'll tell your therapist about this" turns therapy into punishment. It erodes trust, increases fear, and makes the therapist feel like an authority figure instead of a helper. Kids then enter sessions guarded, defensive, or silent. And as a parent, you also don't want to be asking for a play-by-play of the session. Kids often don't have the language, memory, or desire to recount everything, and they shouldn't have to. Pressuring them for details can feel intrusive and can make them worry about saying the right thing to you. It also undermines their confidentiality, which is essential for therapeutic safety. Ultimately, your job is to create safety, not performance. When kids feel safe emotionally, relationally, and physiologically, therapy becomes a place where they can explore, experiment, and heal. When they feel evaluated or pressured, therapy becomes another arena where they must manage adult expectations. Parents and caregivers, though, are essential partners in child's therapy. The therapist supports the child only when they have them really truly in office, but you support them every single day. So, what collaboration looks like is sharing observations with the therapist about your child's mood, behavior, sleep patterns, school, or other stressors that you see. It's making sure to practice those skills at home whenever they're recommended, and attending parent check ins or family sessions if the therapist offers those to you. And also asking questions of the therapist whenever you feel unsure, and supporting routines that help therapy work. Collaboration, though, does not mean that you're going to get detailed reports about everything your child said. It also does not mean that therapy information should be used to discipline or interrogate your child, or expecting the therapist to fix things without family involvement. Collaboration also does not mean overriding your child's pace or privacy needs. Therapy works best when caregivers and therapists work together as a team, each with their own role, each protecting the child's emotional safety. In preparing your child for their first therapy session, you want to keep it simple and again age appropriate. You may say something along the lines for a younger child that you're going to meet a grown-up whose job is to help kids with their feelings. You can talk, draw, play, or take breaks. You get to go at your own pace, and then vary this depending on the age of your child. You can also offer choices to help reduce your child's anxiety about attending therapy, such as offering your younger child to take their favorite stuffed animal with them, or your older child to bring some sort of fidget or sensory item that helps to ground them. You can also ask them if they want you to stay in the waiting room for the entire session, or maybe come in at the beginning to meet with a therapist briefly. Normalize their nervousness. Let them know that it's okay to feel shy or unsure. Lots of kids feel that way at first. Other ways to support your child's anxiety about therapy is to keep those routines predictable. So, for example, if they get a snack when they first get home from school, give them a snack before they go from school to therapy. Offer those grounding tools like a stuffed animal or a fidget, and use calm and simple language. After sessions, you also want to give them an opportunity to decompress. Therapy can be very heavy regardless of your age, so give them some space to relax, calm down, offer a snack, quiet time, say that you're proud of them for trying something new, and again, avoid the pressure to share details. Let the therapist guide the pace about what's going to be shared. The first session that you have with your therapist is usually what is called an intake or a mental health assessment. It's simply that first step in understanding what's going on for your child. It's not a test, not a judgment, and not about labeling them. The goal is to gather enough information to support them. Most intakes begin with understanding what brought you in. The therapist or clinician asks about when challenges started, what's been hard at home or school, and what you've tried already and what's worked and not worked. This helps them understand the why now for starting therapy. They'll continue to gather information about your child's background, learning about development, medical history, school experiences, friendships, and any recent stressors or big life changes. They'll also ask about your history as a family, if there's anything in regards to any mental health diagnoses of either parent, any substance use issues, and also the learning about medical history of the family as well. They'll move then into talking about emotional or behavioral issues. They'll explore mood, worries, coping strategies, attention, and how your child handles transitions or changes. For younger kids, this may be directly talking to you as the parent, or they may observe this through play. For teens, they'll often engage them directly in the conversation as well. The therapist may meet briefly with your child to introduce themselves, show them around the room, and ask simple, gentle questions. Kids are never expected to open up right away. Some intakes also include the use of screening tools, which are just short questionnaires that are used to identify patterns related to anxiety, attention, behavior, or mood. These tools do not diagnose on their own, but can help lead to a diagnosis. The clinician then shares what they're noticing, what might be contributing to the challenges, and what supports could help. From there, they also work with you to plan the next steps. You'll leave with clarity about what the treatment goals are, what therapy might look like, and how to support your child at home. Diagnoses will also come up during an intake. And a diagnosis is not a label. It's a clinical shorthand that helps everyone understand what kind of support a child needs. It describes patterns, not the child. It helps answers questions like, is this anxiety? Is this ADHD? Is this trauma related? It organizes information. It doesn't define your child. Diagnoses also help to guide treatment. Different challenges respond to different approaches. A diagnosis helps match the support to the need, whether it's play therapy, CBT, cognitive behavioral therapy, parent-child work, trauma-informed care, school accommodations, or other treatment modalities that may be best appropriate. Diagnosis is also required for most insurances. Most insurance companies will not approve payment or ongoing therapy without a diagnosis. This is a billing requirement, not a judgment. Lastly, diagnoses help coordinate care. Schools, pediatricians, and specialists often rely on diagnoses to communicate clearly and consistently. Therapists don't treat diagnoses. They treat children, families, and patterns of stress. They use diagnoses as a starting point, not the whole story. They use them to choose effective interventions, and they recognize that diagnoses can evolve as kids grow. Again, a diagnosis is a tool for clarity, not for shame. And a diagnosis is one piece of a much bigger picture that includes the child's temperament, culture, family dynamics, school environment, and their strengths. A diagnosis is a map, not a verdict. There are some differences when it comes to intake and mental health assessment, depending on if you are seeing a therapist in a private practice, their own practice, or if you're seeing one who belongs to a greater agency, especially if it's a community mental health agency that has a lot of other state or even federal level requirements placed on them. Both settings aim to understand your child and build a plan, but the feel and structure can differ. Within a private practice intake, it may feel more relational and conversational, and it's often completed in 1 or 2 appointments. You can expect a warm welcome and orientation into the space, a slower, more personalized conversation, gentle time with your child focused on comfort, clear explanations about privacy, and collaborative goal setting. And there also will be a simple plan for next steps. Overall, that vibe feels flexible and it's very relationship focused. There may even be times during this intake where the therapist will meet with the child alone. So, as the parent, you may only be there at the very beginning and then it moves into more of a session with the child, and maybe you come back at the end. Every private practice therapist does it a little differently. In a clinic or agency-based mental health assessment, you'll see that it's more structured and comprehensive and often includes multiple parts or even multiple providers. You can expect a more formal check-in and paperwork that's involved in the assessment. There's a detailed review of history and symptoms, again, both for your child and as the parents and the family, and maybe even going back farther as far as family history is concerned. There will be very standardized screening tools used within the assessment, and sometimes, again, there may be separate interviews with you and your child. There's also a written report or a diagnostic summary that is included with this, with clear recommendations for services above and beyond just therapy. It may include recommendations for psychiatry, groups, family support, case management, so on and so forth, because most clinics do offer more than just therapy. Again, if it's a community mental health agency, they usually offer a gambit of services. So the overall vibe that you'll see within a clinic is very thorough, standardized, and team-based. Bottom line though, whether you're in a private office or a clinic, the purpose is the same: to understand your child, to reduce confusion, and to build a plan that helps them feel and function better. I briefly mentioned confidentiality earlier, and this is a really important topic. Confidentiality is more than just privacy. It's something that helps kids feel safe enough to open up, helps them to feel trust within their therapist. But it can feel confusing for parents. Here's how it typically works. Younger children from approximately ages 3 to 10, therapists will share general themes, not specifics. So you'll hear things like repractice calming tools. We talked about school stress. You won't hear anything along exact quotes about what your children said, private stories, or any details that they may feel embarrassed about. Safety concerns, though, are always shared. Older children from about the ages of 11 to 14, therapists will share overall progress. However, privacy becomes more important to teenagers, so they'll ask the child what they feel comfortable sharing and encourage that communication between child and caregiver. Details are typically only shared with the child's permission unless safety is involved. For older teens, 15 up to the age of 18, they're treated more like the young adults. Therapists will protect the teen's privacy and share themes, not specific. They'll invite them to include caregivers and parents or bring caregivers in for planning and support. To summarize, regardless of the age of your child, the things that are always shared are any safety concerns, abuse or neglect concerns, which are also generally reportable offenses, any kind of medical emergency, and when a higher level of care is needed. Therapists will also generally share regular progress updates with the parents and caregivers, but again, focusing on themes and not specifics. Those things that are sometimes shared are what the child agrees to share, skills to practice at home, and further updates that may be more specific. What is not shared, again, regardless of the age of the child, are private stories unrelated to safety and sensitive details that could damage the trust between the child and therapists. Remember, confidentiality is not secrecy, it's protection. Parents sometimes worry about what happens with the information their child shares, especially if they're talking about things that are going on at home or they're not really sure what information their child is really talking about. Therapists use information to understand patterns and support the child's emotional worlds. They use it to identify stressors, strengthen family communication, and keep the child safe. Therapists do not use information to judge parenting or report normal family stress to authorities. They don't use it to take sides or share private details with others. The goal is understanding, not evaluation or judging. Therapy is not just talking about problems, it's a layered process. What typically happens in sessions is spending time building trust and emotional safety, practicing coping strategies, exploring thoughts and feelings through play, art, or conversation, working on patterns, not just events, and strengthening the child's sense of agency and empowering them to take more control over their own actions and life. What doesn't happen in therapy is forcing kids to talk before they're ready, digging for secrets, judging parenting, or fixing behavior in one or two sessions. Therapy is a process, not a performance. Let's talk now a little bit about the therapist role and parent role, because understanding the difference helps everyone feel more grounded. The therapist role is to provide a safe, neutral space for your child to feel comfortable in sharing whatever they need to work on their treatment goals. They teach skills, help the child understand emotions, they guide the pace, and they support the family system. The parent's role in the therapeutic process is to continue to create stability at home, reinforce therapeutic skills between sessions, communicate openly any concerns with the therapist, protect their child's privacy, and model emotional regulation. Both roles matter and neither works alone. Therapy is not a one-size-fits-all approach, and different therapists have different type of approaches or styles of therapy. There are numerous different types out there, and some even require additional levels of certification and training on them. So if you are looking for a particular type of therapy, it's really important to make sure that you ask the therapist those sorts of questions. Overall, though, most therapists are trauma informed. And trauma informed therapy isn't about making your child retell painful experiences or pushing them to talk about things they're not ready for. It's a way of working that prioritizes safety, choice, and understanding so your child can heal at a pace that feels manageable for them. At its core, trauma informed care is built on a simple idea that your child's reactions make sense in the context of what they've been through, and therapy adapts to their nervous system, not the other way around. Trauma informed doesn't always mean talking about trauma, and this is one of the most important things for parents to know. Trauma informed treatment is not the same as trauma therapy or trauma processing. Your child may spend sessions or even most of therapy focusing on emotional regulation, stress from school or friendships, building coping strategies, understanding their reactions, strengthening communication and other skills, and learning to feel safe in their body. All of these are trauma informed, even if the word trauma never comes up. Why? Because trauma informed care is about how the therapist works, not what your child talks about. It's about creating a steady, predictable, and respectful environment where your child feels safe enough to grow, whether or not they ever describe past events in detail. For many children, this approach is exactly what allows healing to happen. Let's take a look now at some of the different types of approaches that I'm going to really just kind of basically lump into different categories, starting with talk-based approaches. Talk-based work helps kids make sense of their experiences without pressure or forced storytelling. What it looks like is gentle conversation that follows your child's comfort level. It's reflection around feelings, stressors, and patterns, and understanding why certain situations trigger strong reactions. And it focuses on things that affect them now, not retelling stories or not retelling trauma or specific situations. It helps because it builds insight and emotional language while helping children feel understood rather than judged. Skills-based work gives children practical tools that they can use in everyday life. This may focus around coping strategies for big emotions, grounding techniques if they're feeling overwhelmed, communication skills for boundaries and acting help, and planning ahead for stressful situations. Skills-based approaches may also include anger management skills, problem-solving skills, and decision-making skills. Skills that they learn in session give them something concrete to rely on when emotions or stress feel unmanageable. Body-based approaches are often used in different types of trauma therapies, but it's not something that is just specific to trauma work. Body-based approaches really helps children understand and regulate the physical reactions that happen automatically within their nervous system. Body-based work helps children to notice tension or physical signs of stress that are happening in their body on a regular basis. They'll practice different breathing techniques and not just learning how to breathe, but specific strategies that help to calm the nervous system. They'll learn how to identify activation versus shutdown, which is known as fight, flight, or freeze, which are, again, totally normal physiological responses when dealing with stressors. Body Base also uses a lot of movement or sensory tools to help the body feel steadier. Body-based approaches teach children that their body isn't overreacting, it's responding to stress, and it gives them more ways to feel in control. Creative approaches focus on teaching children nonverbal ways to express things that feel too overwhelming or confusing to say out loud. It'll look like using drawing, doodling, or visual mapping. They'll learn how to journal or do different writing exercises to be able to express themselves. They'll learn how to use metaphors to describe feelings, and it also incorporates body movement through gentle movement or posture shifts that helps to regulate the body. Because it is creative, oftentimes you'll see music or dance or other forms of arts used to facilitate expression. Creative approaches offer safer, indirect pathways to expression, especially when words feel too vulnerable. These approaches can all be utilized together or separately because trauma-informed therapy is flexible. So a session may include a grounding exercise, some talk-based reflection, a practical skill, and a metaphor that can help explain a reaction. Or it might entirely focus on calming the nervous system if your child arrives overwhelmed. There is no one right way to heal. Therapy adapts to your child's readiness, comfort, and their nervous system needs. What you as a parent can expect is that your child will not be pushed to share details they're not ready for. They'll be given choices and control throughout the process. Their therapist will prioritize their emotional safety and pacing. Progress may look slow from the outside, but internal shifts are meaningful, and skills learned in therapy often show up gradually in everyday life. Trauma-informed treatment helps children understand themselves with compassion instead of shame. It supports them in building safety, regulation, and connection, the very foundations that they need to move forward. It's also very important that we speak about the difference between crisis support and normal therapy. Crisis support is immediate stabilization. Crisis services are designed to respond to urgent situations when safety is at risk or emotions feel too big to manage alone. Examples of crisis needs are suicidal thoughts or behaviors, self-harm, aggressive outbursts, panic attacks or dissociation, sudden loss, trauma, or unsafe home situations. Crisis support focuses on safety planning, de-escalation, emergency referrals or even hospitalization if necessary, short-term stabilization, and connecting to longer-term care. Crisis care is fast, focused, and often intense. It's about getting through the moment safely. It is crucial to speak with your therapist about whether they are available or not to provide help during a crisis moment. And in most cases, therapists will not be available to do that unless they just happen to have no one in session at that time. A therapist will typically provide you with ways of getting a hold of them if there is some sort of emergency and let you know if they're not available, what other crisis support lines that you can call during that time. If you are working within a mental health clinic, there may be some crisis level support there available at the clinic, but not necessarily again with your particular therapist. Your clinic will let you know what to do in the event of a crisis. Normal therapy is a steady, supportive process. It's not about fixing everything at once. It's about helping your child grow, heal, and cope in sustainable ways, which is why it's not considered a crisis response. Examples of therapy goals include managing regular anxiety or sadness, improving communication, processing trauma gently, strengthening relationships, and building coping skills and self-esteem. Ongoing therapy focuses on weekly, biweekly, or monthly sessions depending on your therapist's availability or the needs of your child. Trust and connection with a therapist, exploring thoughts, feelings, and patterns, practicing new strategies, and supporting long-term emotional health. Therapy, again, is paced to match your child's nervous system. It's not rushed, it's relational. Sometimes therapy starts after a crisis. Sometimes therapy helps prevent future crises. And sometimes therapists work alongside crisis teams to support both safety and healing. If your child is in therapy and a crisis happens, the therapist may adjust the treatment plan, bring in extra supports, and help you know when to seek emergency care. Crisis doesn't mean failure. Therapy doesn't mean something's wrong. Both are tools, and both can help your child feel safer, stronger, and more understood. One of the processes that happen during goal planning is a discussion on how you know if therapy is helping. And this can be a very difficult question to answer because sometimes it's very difficult to know when things are going well, especially if they've not been going well for an extended period of time. So when you recognize that therapy is helping, you will look for subtle shifts, more emotional language, fewer meltdowns or quicker recovery, increased confidence, more curiosity, better sleep or appetite or other routine patterns that have been thrown off over time, and more connection with you as a parent and more connection with your family. Progress, though, is rarely linear. So you want to make sure that you celebrate any small wins along the way and encourage that motivation to keep working one step at a time. It is important, though, to also note that therapy cannot change family dynamics without family participation. Therapy also cannot fix behavior without understanding underlying needs. It can't work if the child feels pressured or monitored. Therapy can also not replace consistent routines or emotional support at home. Therapy is powerful, but it's not magic. It's a partnership. Maintaining consistent communication with a therapist is important, and parents often wonder when and if they should reach out in between sessions. So reach out to the therapist if there's a major change at home or school, if new behaviors or worries appear, if your child starts to avoid sessions, or you need guidance on how to respond to certain situations, and if any safety concerns arise. You don't need to reach out for minor conflicts, normal ups and downs, or curiosity about what is said in session. This helps parents feel confident and appropriately involved when that communication continues. As mentioned earlier, consistency and commitment to therapy is key in order to maintain progress, but it is not unusual for kids to often want to stop therapy suddenly, especially after a very vulnerable session. This is protective behavior, it's not misbehavior. Some of the signs you may see of your child suddenly pulling away and not wanting to go into therapy is simply saying, "I don't want to go," or they may show some embarrassment about being involved in therapy. They may talk about how it's boring, or they don't know what to talk about, or they may show signs of irritability before sessions. You can support them by validating their feelings and, again, avoiding any kind of forcing or shaming them into therapy. Ask the therapist for a check-in about pacing and seeing if things maybe are moving too fast or even too slow for your child. Normalize that therapy does feel different every week. They may have a good session one week and they may not have a very good session the next week. And when things come up heavy in session, it is okay to feel uncomfortable afterwards, but it's best to keep going. Remind them, though, that they can take breaks if they need to. If a true pause in therapy is needed, schedule a closing session with a therapist and talk with them about guidance about what should be done to continue the progress that has been so far met in therapy. Avoid disappearing without any sort of closure, because you want to really look into what is really causing this need for closure, what can be done while they're out from therapy, and discuss what returning to therapy might look like in the future. Consistency builds trust, and it's important to maintain that as best we can. If your child does continue to talk about wanting to quit therapy and they're struggling with this, some grounding practices and skills can be very helpful for you to do with them. And some of these grounding skills they will work on within therapy as well. But here are some very simple ones that you can do with your child. Step 1, place your hand on your heart and have your child place their hand on their heart. And say together, we're both allowed to feel nervous. Model that emotional regulation. Step 2, take one slow breath together, breathing in through your nose for a count of 4, and breathing slowly out for a count of 6. You may need to do this a couple more times. Step 3, do some specific grounding techniques like naming something you both can see. You can add to that by talking about things that you can hear, things that you can touch, things that you like about yourself, or telling your child something you're proud about them and them repeating something that they're proud about for themselves. Step 4, remind your child and have them repeat it. We can do this one step at a time. Kids borrow your calm, and if you are able to maintain that calm and practice that emotional regulation with them, they might be more likely to continue to engage in therapy. Your presence matters more than perfect words. Your child doesn't need you to have all the answers. They need you to walk beside them with steadiness and compassion. Therapy is a gift you're giving your child, a place to grow, to feel safe, and to learn about themselves. You're doing a good job, and your child is lucky to have you.